Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. Recent news headlines about COVID-19 vaccines have been focused on safety concerns. Both U.S. and international agencies are now reviewing reports of a rare blood clotting disorder among some vaccine recipients. With me today is NFID Medical Director, Dr. William Schaffner, to explain the significance of these reports and the implications for COVID-19 vaccination efforts in the U.S. Bill, as always, thanks so much for joining us.
Always good to be with you, Marla.
So, Bill, what is your take on the recent reports of possible safety problems associated with COVID-19 vaccines, and should we be concerned?
Actually, I think we should be somewhat comforted because the safety surveillance system that the CDC and the Food and Drug Administration have put in place, looking for possible associations with adverse medical events, is so sensitive and comprehensive that it's picked up, for example, these blood clotting disorders that are occurring at a rate of 1 per million doses. We couldn't have found that needle in a haystack 20 years ago. It shows you how committed we all are to vaccine safety. Now, it must be noted that at the moment, this association is in time, but it's not yet been determined to be causally related. And that's why the Food and Drug Administration scientists, as well as the external advisory group to the FDA, are going to be looking at these data very carefully to see whether there might be a causal association. Could the vaccine actually have precipitated these events?
So are these reports unusual? And, of course, the question comes, are they a result of this effort to speed the development of the COVID-19 vaccines?
Well, to answer your last question first, it's got nothing to do with speed. Let's think about this. The occurrence is 1 in a million. You can never find that sort of adverse event with confidence in even large clinical trials that vaccinate 15,000 plus individuals. You can see that. In fact, there was a vaccine developer by the name of Maurice Hilleman. He was an extraordinary person, and he used to say he was never comfortable with the safety of a vaccine until it had been administered to at least 3 million people. So that's all by way of saying there are some rare events that can only be detected only after we start using vaccines, or drugs for that matter, in very large populations of individuals. Now, as to expectations, we're giving these vaccines to people who often already have underlying illnesses. We started at the upper end of the age range, right? People in nursing homes and people 80 and 70 and 60 years of age, where there's an accumulation of background illnesses all the time. So we knew, for example, that we were going to give vaccines on a Monday, and on a Wednesday or a Thursday, medical events would occur, because these medical events occur in these populations all the time. The question would be, is this just a coincidence? Would it have happened anyway? Or is there something about the vaccine that actually resulted in the medical event? This is not an easy question to answer, but there are techniques for doing that now, and they are going to be employed by the Food and Drug Administration and the CDC to see whether these recent events are indeed related as cause, or would have happened anyway, even without the vaccine.
So do you think there are implications from this for overall vaccine confidence here in the U.S.?
I think that works on both sides of the coin. We will try to tell people, look, that means the system of safety surveillance is actually working. We're picking up these very rare events and we're investigating them. But on the other hand, as we all know, there's a lot of publicity that surrounds these kinds of events, and that will give hesitant people more hesitation. And we will have to win them back in order to get them in to be vaccinated. And of course, we'll have to see what the final results of the investigation are.
Sure. So shifting gears a bit, so what do you make of these breakthrough infections that have recently been reported among some fully vaccinated people? Could this be caused by variants, or is something else at play?
Well, first of all, I remind people that we always said the vaccines at their best were 95% effective, not 100%. And so that always meant that despite the fact that people were being vaccinated and protected largely, there were going to be a few breakthroughs. So we anticipated that from the beginning. Now, fortunately, we would anticipate that these breakthrough infections are going to be milder. The other item is during the actual trials of the vaccine, many people were excluded, people with underlying immunocompromising conditions and the very frail elderly. Well, those are exactly the people whom we're vaccinating now. And those folks, I'm afraid, when we vaccinate them, can't be expected to have 95% protection. Their benefits, because they're immunocompromised, because they're so frail, their immune systems are not as functional, not as robust, they're going to get lesser degrees of protection. And so some of these breakthrough infections will indeed occur in those folks. Now, all that said, there's intense surveillance, intense attention devoted to these breakthroughs, looking to see whether an odd variant or not also might be at play. So far, the vaccines are very effective in preventing the most common variant, the B.1.1.7, the British variant, but we'll keep monitoring these breakthroughs to see whether another variant, the South African one, for example, or the Brazilian, which may not be covered quite as well by our vaccines, start to be most common. So constant surveillance for these breakthrough infections is very important.
Sure. So, Bill, how should healthcare professionals respond if patients ask about COVID-19 vaccine safety and effectiveness? And I guess more importantly, what are you telling your colleagues, friends, and family?
Well, I'm telling them, first of all, that the vaccines are extraordinarily effective, and there's just evidence of that. Since we've vaccinated people in nursing homes, which used to be a hotbed of outbreaks of COVID, you notice we haven't heard anything about outbreaks in nursing homes since we've vaccinated those frail people. These are powerfully effective vaccines. And as to safety, they're also powerfully safe. The adverse events that we have detected have been largely local and transient, and potentially rare, really rare adverse events are still under investigation, but they will be rare. And, you know, in comparison, life isn't perfect. There's no perfect vaccine and there's no perfect drug. There are always going to be adverse reactions, but the danger from COVID vastly exceeds the danger from the vaccines.
Well said, as always. So, Bill, before we sign off, are there any parting thoughts you'd like to share?
I think we all need to keep tuned. There will be new things that are happening, and we will try to communicate those clearly, transparently, and directly and promptly so that both the medical professionals and the general public are aware of what's happening. But I think we are in a race between vaccination and the virus itself, which is spreading widely in certain parts of the United States. And I think we need to keep vaccinating in order to catch up and get ahead of this virus.
Bill, thanks as always for those words of wisdom, and we look forward to talking again soon on the next edition of the Schaffner Report.
Always a pleasure.
Bye-bye.